Good day. Hi, I'm Brian Castle, MD, MPA, a physician executive, who's been doing this for about 50 years. And you all recognize Poppy. Well, this is his stand-in. Poppy's off visiting today, so I can actually say what I want and he won't interfere. So Poppy and I now will continue to discuss what we've been talking about, and that is Healthcare 2020. So saying that, I'm going to move out of the way. We're going to concentrate on the slides and move forward. Healthcare 2020, what should be done? And you all know about Poppy. So let's talk a little bit about what we're going to talk about. We're going to start with Medicare for All. And this is the Democratic presentation. And it's what is being considered as we move in that direction. It's health coverage for all Americans to include items such as premiums. And you know where the premiums are. You have to pay those before you can even get close to your coverage. It also includes copays, which you pay at the doctor's office, and deductibles, which you have to pay before you even can get into this healthcare benefit coverage. It's expansion of Medicare to younger Americans, essentially replacing both Medicaid, which is currently for the low income and disabled, and employer paid, which is for workers. The current for-profit healthcare insurance model would then be reduced to supplying supplemental coverage, and that will not go unnoticed by the fourth party decision makers or the third party payers. And the benefits seem to be along the line of our current ACA coverage, but they will include things that Medicare does not cover, which is prescription drug coverage, long-term care, and full mental health coverage, including addiction. And Medicare for All has multiple scenarios. It's not just, let's just jump from where we are, which is the status quo, to Medicare as a single payer, excluding Medicaid. Here's the way it'll work. We're going to look at the various options. It'll be along this row. We're going to look at the age in. We're going to look at the enrollment, the shift that will happen to Medicare, and we're going to look at the numbers. So very, very simply, here's where we are today, the status quo, where we continue with our for-profit health care insurance model. Roughly 43 million folks in Medicare. The next step would be voluntary buy-in at 50 years of age. And that means instead of 65, at 50 and beyond, you get to decide if you want to voluntarily buy into Medicare. What's predicted is an 85% shift of those over 50, with 70% shift of those over 50 who are currently uninsured. There should be no employer shift, folks that now have employer-covered benefits, and roughly about 32 million additional beneficiaries. The next phase then is voluntary buy-in with employer choice. Again, you start at 50. The shift will be about the same, 85% of greater than 50-year-olds, a 70% shift of those over 50 who are uninsured. But what will be new is 50% of the employer base are estimated to shift to Medicare. So the total there may be closer to 50 million. Then we would go to Medicare as a public option. And it's a public option, 100% all. You'll have 50% shift of all employer-sponsored, all ages, 85% shift of greater than 50-year-olds who are in the individual market, and a 70% shift of all of the uninsured, which will then bring the total to additional 77.5 million. And then there is Medicare as a single payer for all, 100% mandatory enrollment of all commercial uninsured lives. Total an additional 172.6 million beneficiaries. But that's not the only option that's out there. There are many other options. And we'll talk about each of these in a little bit. But if we start in the middle, which we currently are with the multi-payer and the ACA, let's see what people are thinking today. Folks think that here, if we add Medicare as a competition to private plans, that might be a good idea. 86% of Democrats say it's a good idea, 68% of independents say it's a good idea, and 36% of Republicans say it's a good idea. But then there are a lot of questions. What is the role for private insurers? What are the transition periods? What about increased taxation, larger government role, the fate of current plans? What does it mean to me as a healthcare consumer? And how many choices of health plans and competition in the marketplace? Now, if we look at those who say we should build on the ACA, about 55% of you say that's what you want. And there certainly are more choices than just the deficit reduction that we've seen in Congress, or the ACA that we currently have now, or even Medicare for All, which we discussed previously. And by the way, 39% of you seem to support that. So as we move in this direction, we have a specter of less generous benefits than the unions currently enjoy, but more covered people. Could be an issue. Now, we will talk in depth about all of this in future vlogs of this series. But this is where we'll stop today as far as looking at the various choices. Except maybe let's talk a little bit about some of the common finance models that are out there. And what are our choices? Well, there are four major models for healthcare systems. There's the Beveridge model of National Health Service, and this is public funding, public delivery, socialized medicine. Government pays for all. Then you have the National Health Insurance model. These two are full 100% one-party payer. And the National Health Insurance model, unlike the Beveridge or National Health Service, this has public funding but private delivery. In other words, the government doesn't own the folks who deliver the health care. And it's in the ballpark of Medicare for All. So when we talk about Medicare for All, we're talking about some form thrust of national health insurance, not a form thrust of National Health Service, which is where the government owns and pays for everything. And then there are two models that have multi-payer. There is a Bismarck model, which is also an all-payer, and it's got mixed funding, much like our system today, private delivery, much like our system today, but it's highly regulated nonprofit insurers, big difference than what we have today. And it does expand on the ACA's regulatory pathways. And then we have what we have today, and that's the multi-payer, which is really mixed funding, mixed delivery. Now, what current model would be the basis for the government-sponsored healthcare portion? According to the Kaiser Family Foundation, about half think they'll be able to keep their current insurance, which is flatly false. This is a quote from the Kaiser Foundation. That, to me, might be the biggest concern facing healthcare consumers moving forward, because at the end of the day, no system escapes criticism. It appears that there is good, bad, and ugly to be found in any system you choose, and for sure there would be winners and losers. Health plans, which are the major element in our current dysfunctional for-profit insurance model, might go the way of endangered species. The pharmaceutical industry will definitely be reined in. Providers have mixed options, and with that in mind, they should play a key role in moving forward. So, what have we learned today? We've sort of started to crack the surface on some of the options that are out there. There are many potential variations on a theme of healthcare reform, as there are opinions as to what Americans are worried about or will support. In essence, you have a myriad of variations on a theme. You have the one-party payer variations with the National Health Service, where the government pays for health care and the providers of health care. You have the National Health Insurance model, single payer national health insurance similar to Medicare. And then all the variations of that, which we talked about: voluntary Medicare buy-in, compete with the private plans, voluntary buy-in with employer option. And then you have the multi-payer options, the Bismarck model, which is basically a social health insurance model, and our current market-driven, out-of-pocket healthcare process, which we're needing to replace. So, the bottom line is this. We're going to be talking in the next 2 vlogs in this particular part, which I'm calling part 2, in more detail on all of the things that we sort of introduced today. But now comes the commercial. Thank you for joining me today to discuss the future of healthcare. I am Brian Castle, MD, MPA, and I have been in healthcare for almost 50 years. This book, which has just now come out, is available at all the usual places. And if you have questions about healthcare, and if you're concerned about the healthcare you have, this book may very well help you with the answers and give you your choices. So, I just want to say, subscribe to my vlog. Go to my website, www.americanhealthcareintransition.com, and we, my book and I, will talk to you again soon. Good day.